Thanks, Shelby. Just gonna press got it, and I'm trying to do a little housekeeping as we talk here. Okay, so for everybody who's popping on, we love to see you. Go ahead and mute yourselves. Or Shelby, if you can go ahead and mute people as they come in, that's awesome. It looks like everybody has their video off, which is great. If you want to have your video on, you can. You can also go to the little, if you go to your own picture, like I see my cursors over my face here. Dr. Mensa, can you see that? If you go to the top right-hand corner of your picture and you click on the three buttons there, you can choose to rename yourself. And Dr. Mensa is going to send a screenshot of what that looks like in the chat. And you can rename yourself anything you'd like, so you can continue to keep yourself anonymous. It can be your favorite fruit, it can be your initials, you can do whatever you want. I want to start by introducing myself and Dr. Mensa, and then I'm going to actually ask that while I'm doing that, and at any point during the talk, that you post your questions in the chat. If you are embarrassed or nervous or don't want people to see who sent the question, you can just in the chat choose my name, and we'll still see those questions, or choose Dr. Mensa's name and we'll still see those questions. We will answer them as we go. And my goal is to really make this useful for you. So the more questions in the chat, the more I can really direct the talk towards you. We speak very frequently on this topic, and we even speak nationally and internationally on this topic. So we're not coming here with a prepared PowerPoint. We're coming here with all our expertise and kind of being available to you in this sort of open forum, as comfortable as you guys can make yourselves, to answer the burning questions that you have about intimacy and sex with a cancer diagnosis. So my name is Dr. Roy. I am a natural medicine doctor. I'm a fancy kind. What that means is I have both the conventional training and the training in natural therapies. My medical license is in Vermont. In that state, I can prescribe drugs as well as natural therapies. In Michigan, we're a little bit behind. In addition to natural medicine, I've also done residency and fellowship in something called integrative oncology, or naturopathic oncology, which is a fancy way of saying I'm one of the nation's experts in how to combine conventional medicine with natural therapies and nutrition and supportive care in a cancer population. There's about 75 of us in the United States and Canada, and we have different focuses, different kind of expertises. I'm a generalist. Dr. Mensa has a larger skill set than I do in nutrition and lifestyle measures and exercise. And so I'm going to be relying on him to jump in and answer some of those questions if they come up. I don't know if anybody has questions about who we are, and looking at how people are changing their names, which I love. I love Flower, unless that's, of course, your real name, or Elf. Maybe that is your real name. But if you do want to know more about us or what we do, you can go to aimnatural.com and look at our website and contact us, and we can also answer questions that way. Okay. So I'm going to ask again that people pop their questions in the chat. I don't see anything yet. And until we do, I'm going to go ahead and just ramble. Dr. Mensa just put in a form in the chat that you can click on. It's a link, and it'll take you right to the Contact Us page, which allows you to ask questions privately about natural medicine, nutrition, and cancer. So any questions, and you guys can unmute yourself. It's not like we'll know who you are with your microphone off. Any questions about who we are, what we do before we get started? Okay. So as I talk, I'm just gonna start talking, and you guys can jump in at any time. and I will modify and redirect myself based on what you asked me. So in terms of sex and intimacy, I want to start by saying that they're two very different things. Sex, we think of as intercourse, and intimacy is the experience of truly connecting authentically with another person. At least that's how I think of it. And I think both of those are impacted when we face a cancer diagnosis. But for many of us, intimacy is far more important than sex. And for us, spiritually, emotionally, physically, even with a cancer diagnosis, intimacy can be critical. And I should say, as we're talking, I'm going to use really heteronormative language, meaning I'm going to refer to male-female relationships, male biology, female biology. And that's not to be exclusionary. It's not to say that relationships that fall outside of those heteronormative norms are not going to benefit from this talk. You just are going to have to flip my language in your head. And if you have specific questions that involve relationships that are not heterosexual, post them in the chat and we'll talk about those as well. Okay. I will cover men having sex with men and women having sex with women briefly, unless I feel like it's not that useful for the group. And again, we're sort of blind, like I'm literally looking at myself while I talk, and Dr. Mensah is looking at himself while we talk. So without questions, it's hard to know how to direct you. I want to start by saying thank you, Flower, and I'm going to come right back to that. I want to start by saying that as you guys may realize, about 20%, 22% of cancer patients struggle with PTSD, which is post-traumatic stress disorder. And a lot of that has to do with, as we go through a cancer diagnosis and this whole journey, so much gets taken away from us. But a lot of what gets taken away is our ability to connect to others, whether physically, emotionally, spiritually, in many different ways. And there's an invasion of your privacy. It's almost as if your body has betrayed you, and now you're subject to constant examination and assessment, which can involve a stranger telling you to take your clothes off, or a stranger asking you to assume positions that you would normally have to have real trust with to do so. And so it's a really unnatural relationship, and that unnatural relationship can be very triggering for people. So a big part of talking about sex, intimacy, and cancer is understanding that there's other factors other than physical factors. So I see a question here about uterine cancer, debulking, and no longer seeing a gynecologist. Do I need to be concerned about how HPV causes cancers, and how do I monitor for it? So for uterine cancer, my friend, HPV is not a risk factor. It's a risk factor for cervical. And so I'm assuming what you're asking is, do I need to be concerned about screening for cervical cancer or HPV-related cervical cancer? Now, I don't want to assume everybody has the same level of education, so I'm going to talk really simply and basically about some of these things so that we all can get the information that we need. HPV is a human papillomavirus. There's 60 or more strains, and several of those strains result in cervical cancer in women and oral cancers in both men and women, or head and neck cancers. Those strains that cause cervical cancer are screened out, meaning the government and the country have decided that doing a screening exam every 1 to 2 years is a good way to prevent that cancer from happening. So that screening exam is your PAP. And I think what this person is asking is, since I don't have a gynecologist, do I need a PAP exam? And correct me if that's not what you're asking. In a Pap exam, what happens is they take a scraping of the normal cells of the cervix. Now, the cervix is the doorway between the uterus and the vagina. So it's literally like almost like a sphincter, a round doorway. And they take some scrapings of those, send it to a lab. A lab determines if you've been exposed to HPV and if it is a strain that can cause cervical cancer. If it is, usually they'll just see if your immune system takes care of it. If your immune system doesn't, then they will repeat the Pap. And if it comes back positive, they will do what's called a colposcopy, which is a tiny surgery to remove the cells that are precancerous from your cervix. In terms of oral cancers for men, there is HPV screening with your dentist, and all dentists should be doing HPV screening for head and neck cancers. You can ask your dentist for it. The question is, if I've had a debulking, do I still have a cervix? And the answer usually is no. Usually they would take the cervix along with the uterus and create a blind cuff with the vagina. So for the patient who's asking that question, you would want to know for sure what kind of debulking you had, and do you have a cervix or any cervix remaining? Likely you have a vaginal cuff, which is a blind end, and no cervical cells or cervix cells remaining. If that is the case, you do not need a regular Pap to screen for cervical cancer. Should you have a gynecologist? Yes. You should have a gynecologist because there's other things that can occur, like vaginal dryness, which we can talk about at length, and strategies for that, or urinary tract infections, yeast infections, all sorts of problems, because the genital urinary tract is a really rich microbiome, meaning it's full of all sorts of critters that help you and some that may not, but that work together in this beautiful jungle to manage your body's needs. And that same microbiome lives in your gut as does in your general urinary system. So also your immune system lives in those areas. And it's really important to take good care of those systems, regardless of having a debulking. I will say, with HPV, it is not conventionally known, but it is known on our side of the field that we can reverse HPV positive results by supporting your immune system with a really specific protocol. So if that's something you're concerned about, and you're concerned about cervical cancer, you 100% should see us. I see a question, are there videos or programs that patients can use in the privacy of their own homes versus sending a referral to, and I think that's obscured by an emoticon, but I think you meant PT for sexual health and function. Yes, there are. And is there a professional training for NDs to get certified in providing sex intimacy therapy for cancer patients? So let's start with the question about physical therapy in your own home. So when we're talking, I think what this person is talking about, and since you sent it to everybody, I'll just refer to your initials. I think what MP is asking is about difficulty having sex after a diagnosis due to difficulty with pain, and pain with entrance of the vagina and pain with intercourse. If that's not what you're referring to, then go ahead and let me know in the chat. Good. So there's a couple things that I want you to work on first, and one of the people in this talk just mentioned it, and that is vaginal dryness. So vaginal dryness is fairly complicated, but best approaches for vaginal dryness, and I'm going to open up a screen so you guys can see what I'm doing. And if I'm talking too fast or I'm going too fast, let me know. Because I want you to pick up what I'm putting down. We're not going to get to everything. And if you don't put your question up there, we probably won't get to it at all. But for vaginal dryness, which is the first problem that we want to tackle here, the vagina is not over time, first of all, the tissue ages. Second of all, you may have been exposed to radiation and drug therapy that put stress on that tissue. And third of all, your microbiome may be compromised. So the first thing to do is to inform your microbiome. So Dr. Menz is going to post in the chat now to everybody nutrition strategies. And if you don't know how to use the chat, you can unmute yourself. Nutrition strategies to replenish the gut. Okay, that's really, really important. So he's going to post in there some foods that are really important, and I'll put them up here as well. Other things that we can think about are botanicals. So we like to use teas that replenish the gut, and some of those teas include slippery elm, marshmallow, corn silk, alfalfa, because they'll resupply minerals and nutrients to the gut in a different way, alfalfa, in a different way than going through using a supplement might. And then supplements are very important for informing the gut. Things like high quality pharmaceutical grade probiotics. And the best brand here is really Claire. Probiotics, which you can't get over the counter, but I'll talk about that in a minute. If you aren't able to colonize because your gut is very compromised, then including fermented foods and something called Sacro-B. Sacro-B is a way of creating a placeholder in the gut microbiome so that probiotics colonize better. Now, I'm talking about vaginal dryness, but are these strategies appropriate for men? They're 100% appropriate for men. We use them for our prostate cancer patients, bladder cancer patients, but in general, any patient that's been, or any person that's been exposed to cancer treatment, cancer drugs, radiation, or surgery can afford to improve the microbiome. And I can go over specifics in just a minute. Or more specifics in just a minute. So as you can see, Dr. Mensa is posting some things in the chat here, and I'm going to put them on here for those of you who don't know how to use the chat. Secondly, for vaginal dryness, there's two things you're trying to do with the vagina, which is you want to moisturize and you want to improve elasticity, which is the stretch of the vagina. And again, if I'm talking too fast or I'm moving too fast, you're going to let me know, okay? And I see some beautiful questions here. I'm going to get to those. So moisturize. As the vagina ages and as it's exposed to treatment, the vagina gets, the tissue gets thinner and more friable, easier to tear. And so what we like to use as a moisturizer is two different strategies. One is pharmaceutical, one is natural. Both work very well. Replens or Reverie, which you can get over the counter. You kind of need to use them for a lifetime, unfortunately. So 2 to 3 times a week to start. And then you can go to 2 to 3 times a day for 2 weeks is what I meant. And then you can go to every other day or 3 days a week. And or coconut oil or olive oil, although olive oil has kind of an intense smell, but has been shown to be effective if you use it in a pump dispenser in your bathroom. After you take a shower or after bathing, you apply vulvovaginally like you would do with lotion. So just like putting lotion on your hands, the same kind of deal. And you would do that every day. This helps to improve the moisturization of the vaginal tissue. Are there supplements that are effective here? There are. And I want to remind people we're not prescribing here right now. None of you are known to us as patients. And some of these things can conflict with your conventional treatment. So when patients come to see us, in addition to looking at them head to toe, running blood work from head to toe, understanding how their body uses nutrients, sugar, fat, etc. We're also boarded interaction between natural therapies, drugs, and other types of treatment. So what I don't want is for you to use something that might conflict. For example, what's one that people might use? Vitamin E can increase the aggressiveness of certain kinds of cancers, especially if it's not a mixed tocotrienol or tocopherol. Black cohosh has excellent data that it both lowers the risk of recurrence with breast and also helps with the health of vaginal tissue. Now, it may feel like to you like these strategies are not effective if you've tried them and perhaps you've tried them for some time and they're not giving you the results that you would like. We now know that using a very low dose estriol topically, which is actually estrogen itself, so low dose estriol, and by low dose, I really mean a 0.005%, 0.005% estriol cream topically is safe even for breast cancer patients who are worried about risk of recurrence. You'd want to run it by oncology, but we're pretty successful at negotiating with oncology, and the data is very strong. Coming back to what we were talking about with estriol, you can also try estradiol tablets at a very low dose as well, so 12.5 micrograms a couple times a week. So micrograms, not milligrams, 2 times a week. Now, before somebody asked a question about, do I need a gynecologist, even though I've had a debulking for uterine, this is a good example of why you would need a gynecologist, is to inform and support your vaginal tissue. And this is by no means comprehensive. When we're talking with someone about vaginal dryness, these strategies are really individualized and a lot more comprehensive. I want to go over elasticity now. So we just talked about, I see a lot of questions here about elasticity. And Dr. Mensah, go ahead and pop up in the chat different kinds of supplements that we would use and what the problems might be with using DHEA or green tea or those kinds of things. And as he's putting that in the chat there, I see questions on elasticity, and don't worry, I am going to get to physical therapy. Did I hear a question there? Nope. Okay. So elasticity is the stretch capacity of the vagina. So once we improve the vaginal dryness, we want to talk about elasticity. And to talk about elasticity, there's a lot of different strategies here, but I'm going to focus on a couple. And what I'm going to focus on is physical therapy and dilators. So first of all, I want you to start with mental and emotional. You want to find out what works for you in terms of what makes you happy, what turns you on, what is comfortable for you. And to do that, you want to improve your tolerance for cuddling, masturbation. And the reason why is a lot of it is a head game, no pun intended. Because for many people, intimacy starts in the mind, right? And I want you to be working on what works for you. And again, this doesn't just have to be for people who have vaginal sex, anal sex, oral sex, manual sex. All of that begins in the head, not in the mind, not in the body itself. And as we go through treatment, we can become really intolerant to being touched, and to being touched in a way that asks us to be vulnerable. And so starting with what can you visualize, what can you experience, what can you expose yourself to mentally that can improve your tolerance to that is a really important piece. And we'll come back to that if it's important to people. In terms of pelvic floor therapy. So pelvic floor therapy is what the patient was asking about, who asked about PT. So I love the Women's Health Center, Women's Urology Center at Beaumont. I love the PTs there. There's also another franchise called LunaWorks, which I think is really excellent. But the question is, what can I do at home? And there's a couple things that you can do at home. So first and foremost, I want you to experiment with dilators. So I want you to look at getting a dilator, and I want you to look for the soft kind that are plastic, and a dilator means it looks like a dildo, but it comes in a range from small to large. It comes as a set, and they're usually really soft and stretchy. And I want you to experiment using lots and lots of lube. And the lube that we really prefer is non-glycerin, non-petroleum brands. And here's a couple on here. We'll talk about lube later. If people have questions about it. And experiment just with lots of lube and the smallest dilator just at the opening of the vagina or the rectum, and see what your tolerance is. Not to move it around, not to work with it at all. Now, if you feel like you need support in how to do that, I had posted it on a talk I just did or maybe a couple years ago. There's a company online, and I'll find it and I'll put it in the chat. There's a company online, I think it's called Pelvic Co. It's out of Canada, that has a whole series of pelvic floor therapy videos that you can do in the privacy of your home instead of doing them with a therapist, which might be very embarrassing for some. After you start to get comfortable with experimenting with dildos, I want you to really focus on finding the right lube for you. And again, they should be glycerin-free and petroleum-free to lower your risk of recurrence, but also to lower the risk of compromising the microbiome further, which will exacerbate vaginal dryness. Oof, I'm gonna take a break there. So I'm gonna screenshot this actually, and I'm going to put it in the chat to everybody. And I'm going to pause for a second, see if I'm answering questions as they come. Okay. Let's see if there's others. Is there professional training for NDs to get certified? I don't know if you're an ND, Maria, but yes, there's a ton of training for certification. You can kind of Google it. Doesn't matter if you're an ND or anybody else. Anybody in the healthcare profession can get certified in sexual health, sexual therapy. You are an ND. Okay, beautiful. So why don't you reach out to me personally, and I'll send you a talk that I did for the national conference. I'm going to put my email up here for you. Okay. And I'll send that out to you. Perfect. I have a vaginal cuff. Sex is painful and stressful. I have vaginal dryness. I fear penetration. Is my body different now? Great question. It's so scary to go through surgeries and have all these changes and not know, right, what could happen if you have sex. So first of all, again, having that anticipatory anxiety is totally normal. And it's not just because you've had these surgeries and these changes, but it's because of all of the stress and trauma associated with it. This book is going to be very controversial, but I'm going to post it anyway. There's a wonderful book, and you guys should ignore the title, called The Lesbian Guide to, or Whole Lesbian Guide to Sex, or something like that. Can you pull it up for me? Dr. Mensah. It's by Felice Newman, and I'm going to post the actual picture in a second. Felice Newman is an excellent sex educator who is nationally well known. And this may seem like a crazy book for me to be recommending to a lot of people who may be in heterosexual marriages and maybe a little bit older. However, this book is excellent because the lesbian community, in at least at the time that Felice Newman was writing this, was really focused on non-penetrative intimacy. And so each chapter goes over how to communicate about different kinds of sex. So first of all, how to communicate about intimacy at all. So one of the reasons why you're anxious about it is not even really knowing how to talk about it, right? How to communicate your needs, how to communicate what you feel, how to talk through that anxiety. And then each chapter goes through a different type of non-penetrative intimacy, like manual sex or kissing. There was a whole chapter on kissing that talks about, again, how to talk to your partner about it, how to experiment with it. So if you hate the title, just rip the cover of the book off if it makes you feel embarrassed in any way. But I literally recommend this book to almost every patient who's struggling with sex and intimacy. And it's been very helpful for me in my growth as well. And that may help with some of that. Thank you so much. Dr. Mensah just posted the link to that book on Amazon. You're welcome, Maria. So I think on there, I think starting there with managing the anxiety by learning how to talk about it and learning how different people talk about it is a good first step. Second of all, this is not the first time that we've done this talk. If you go to AIMNet, and they're all different, all these talks are different. So you're going to get different information through each talk. If you go to aimnatural.com, and I'll just do that for you right now. I'm going to stop share and I'm going to go to aimnatural.com. And you take a look at our website here, which I have up here. Not the most sophisticated website in the world, but if you go down to the bottom here to this little video icon and click on that, you'll see a bunch of talks that we do about every topic. And there's quite a few on here on sex and intimacy. And I don't know how to pull them all up, but you can. I'm sure you just click on videos. Yeah. And there's quite a few talks on sex and intimacy here, some of which may have different kinds of information that's important or interesting to you, and may help with some of that anxiety that we're talking about, my friend. The other thing I would suggest is using a non-narcotic, non-habit forming anxiolytic. Theanine is really excellent at 200 to 400 milligrams. You shouldn't really combine it with Shelby, if you could go ahead and mute whomever joined there. I'm gonna go ahead and mute them for you. So 200 or 400 milligrams at bedtime, you shouldn't combine it with wine or other kinds of alcohol, but it's a non-narcotic, non-habit forming anxiolytic. And it can be really helpful for reducing some of the stress that you're experiencing, anxiolytic, for reducing some of the stress that you're experiencing before you have intimacy. Another thing might be scheduling it might be helpful. So if you have a partner or if it's your husband that you're trying to work with, making it a schedule where every Thursday at 8 o'clock, I don't know if this will make you more anxious or less anxious, but you know that you've set aside 20 minutes and intercourse is off the table. What you're working on is small touch exercises. So things like giving each other a foot rub, washing each other's hair, giving each other a manicure, rubbing each other's neck while talking, sitting back to back or sitting back to chest, and listening to a piece of music. So all of these things are ways to improve intimacy and may reduce your anxiety because you know that intercourse is off the table for right now. So coming back to the question about anxiety, the other part of that question was, I have vaginal dryness, which I hope we've given you some solutions for, but again, those other talks are going to have a lot more, and we can keep talking about it if people keep asking us about it in the chat. The other part of that question is, will something harm you, or will your body react differently to intercourse if you have a vaginal cuff? And it's a very real question, right? And a very real concern. And the answer is no, unless your partner happens to be very large, in which case, positions that may work better for you are side to side, where he's on his side behind you and you're on your side in front of him. That can be very helpful in slowing down the depth of intercourse. And if you're very worried about it, there's a company called ONUT, which I think I love ONUT, and I'm going to put it up here for you in the chat. And by the way, the person who asked me about PT Online, this company has a lot of resources as well. The website is called The Pelvic People, and O-nuts are little soft donuts that you actually put over the penis, that, or whatever you're using for intercourse, it can even be a dildo, that allow you to control the depth of penetration. So I'm going to share my screen with you here. So this is an example. This is their website. You won't be able to feel them. They're soft, they're stretchy, they stick. So it's an excellent way of changing or modifying the depth of penetration for my people who are concerned about anal or vaginal sex, or even oral sex, if that's a concern for you as well, if you've had a neck cancer. So good. I hope that's helpful for that question. Moving on to the next question here. And again, keep these coming. They're very helpful in helping me to direct this. I see some of my guys on here are not posting any questions. Maybe you're here to support a partner. Maybe you're here for yourself. Please don't hesitate to ask us any questions. And if it makes people more comfortable, Dr. Mensah can answer them. Dr. Roy, I've had my ovaries removed and have been in menopause since then. My vagina is dry and sex is so painful. Even using a ton of lube works. Okay, and the tightness is an issue. Things tear, it's very painful. I've tried using Reverie, but it doesn't work. Maybe I need to use it more often. I can't take hormone because my cancer is hormone fed, but since sex has been more painful, I don't have a sex drive. Intimacy went out the window. I need to incorporate all of the things that you're saying. Okay, good. So you kind of summarized all of it. So let's start with vaginal dryness. It's very important to treat the microbiome first. You want to start from zero, guys. You don't want to be like, how am I going to get penetration going? Again, penetration is not necessarily the answer. And studies show that men feel a great deal more satisfaction when their partner is satisfied. Or I could put it this way, your penetrative partner feels a lot more personal satisfaction when their receiving partner is satisfied than they do from the actual act of intercourse itself. I hope that made sense to people. So you want to start with improving the level of intimacy between the two of you and working your way up to penetration. It may not be for months, it may be for a year or two before you even get there. And the journey to get there should be fun and not something that's scary. If you're scared or intercourse is painful for you right now, it shouldn't be your focus. It's not necessary for it to be your focus. And I hope I'm being really clear there. You've tried Reverie. I don't know if you've tried Reverie and Replens or if you've tried just Reverie. If Reverie is a different formulation than Replens. So If you tried Reverie and it didn't work, try Replens. If you tried it and you tried it for a couple days and it didn't work, it needs to be 2 to 3 times a week, or 2 to 3 times, yep, a week for the first 3 weeks, and then 3 times a week. And you could use it every day, it's just expensive. If you want to try Replens and Reverie or Replens or Reverie and coconut oil vulvovaginally, you should do that. But you want to first focus on intimacy and the microbiome, and then you want to focus on moisturizing the vagina. Coming from moisturizing to intercourse, you're telling me that it's really tight and your husband is unable to penetrate. That tells me you have an elasticity issue in addition to the other problems, right? The elasticity issue has to be addressed using dildos or a set of dilators, and I'll show you what they should look like. You don't want to use the ones that your gynoc gives you because they're usually metal and terrible. You can go online and get wonderful dilators that are much safer and kind to your vagina. And remember, the vagina is the actual organ that's 4 to 6 inches long, not the vulva, which is the outside of the vagina. And I'm just going to post on here, that's a really long link, but Hello Millie is a good site for vaginal dilators. And I'm going to post on here an article with that lists the best dilators ranked from 1 to 10. But dilators should really look, and I'm going to show you, I'm going to share my screen with you. They should really look really small. Do you see this here? They shouldn't look like what the doctor gives you, which is a set of metal, sort of large dilators. And they're certainly not what you see maybe in the BDSM community among men and women who are experimenting with anal sex. They're not, I want you to take the stigma and the kind of the eroticism away from them. They're really just very soft, very small, and you can even get tiny, tiny ones that are the size of a toothpick. To improve the elasticity of the vagina. But as the person who was talking before was asking about PT, it's really important to learn how to use these. So it's not just about having the dilator set. It's about learning the exercises to do with the dilator set that'll improve the elasticity, break up some of that scar tissue, and allow for penetration later. So it's a process, and that's what you usually need a pelvic floor therapist for. Now, if I did a pelvic floor therapist online, if I looked for pelvic floor therapist online, I'm sure I could find, and I don't want to use Hinge, but I'm sure I could find a lot of pelvic floor therapy that could be done in the safety of your home. So here's an example right now, the Vagina Whisperer, online, on demand pelvic floor therapy designed by a pelvic floor therapist. So I haven't looked at the Vagina Whisperer before, but my point being that you don't have to do it alone. So good. I hope that I answered all of those pieces. And if I didn't, oh, the last thing you said, my dear, that you can't take estriol or estradiol because you had a cancer that was hormone dependent. So I want to make sure I'm very clear here. The data shows us that taking a very low dose estriol cream topically, locally, does not increase increase the risk of recurrence of a hormone positive breast or gynecological cancer, particularly breast. So if your doctor is pushing back, you need to push back with data or come see us. And hopefully we can be helpful there. Okay, so let's talk about erectile dysfunction, unless people have more questions that they're going to throw up here. You're so welcome, my friend. And Dr. Menz is going to post that JOT form one more time. and I'm going to say a couple things about supplements and a couple things about seeing us. And then Dr. Mensah will start a talk about erectile dysfunction, secondary to treatment, colorectal, prostate, and other kinds of treatments. And we'll talk about solutions there. But I don't know how many of you are men and how many of you are women and what we're interested in here. So if erectile dysfunction is not high on your list here, and it looks like maybe our guys have dropped off. Shoot. Maybe we should always start with erectile dysfunction. So people don't feel left out. You're more than welcome, people. But I want to move on to erectile dysfunction in case one of our initials on here is somebody who's really interested in that piece. And I want to start quickly by saying something about supplements. When we talk about supplements here, which we will with erectile dysfunction, and I'll be posting things in the chat to support you guys, I want to make sure that people know that supplements are not well regulated by the government. So when you're buying a supplement from Whole Foods or Better Health or Amazon, you're buying something that has gone through the USDA, like a banana, and not through the FDA. So that means we can't verify if what it says on the bottle is what's in the bottle. We can't verify source. And we can't verify efficacy, meaning we don't know if it works. So in our practice, we only use pharmaceutical grade supplements. That means supplements that have gone through a vetting process very similar to the FDA process that looks at efficacy, quality, source, all of those pieces. And that's the only way we really know whether something is going to work. The problem is in this country, only healthcare professionals have access to pharmaceutical grade supplements through nationwide distributors. So you usually have to go through your doctor, and it can be an ND, it can be a DO, it can be anybody, a nurse, to have access to those kinds of qualities of supplements. For the sake of making sure that you don't feel frantic when we hang up, I'm putting on bewellwithaim.com. That's our access to pharmaceutical grade supplements, and I'm going to put in password AIM that's given out to our patients to order from the nation's distributor. We don't sell supplements, but we make them available to our patients if they need them. So coming back to erectile dysfunction, Dr. Mensah, and let's give this maybe 5 minutes so we can keep answering. I see a couple more questions that came in about about estriol. So I want to answer some of those questions before we close.
Absolutely. So one thing that I will start with erectile dysfunction, oftentimes people think it is a one sort of piece issue. When discussing erectile dysfunction, especially with patients who have gone through some type of cancer treatment, you want to think about it as this multifactorial or the syndrome that kind of gives us this gateway to looking at all of men's health. So instead of looking at it just, oh, okay, I as a man might not have the firmness, I might not have the longevity for erectile dysfunction. You might want to discuss one, mental emotional pieces. So just as Dr. Roy was saying, there was a lot of things talking about there's this invasiveness, this loss of privacy and autonomy and agency when we're going to these doctor's appointments, being poked and prodded during treatments. Also, in that, you might want to think about that anticipatory anxiety that comes from sex and intercourse. And I say that because when we're thinking about just the parts of the body that talk about erectile dysfunction, those are what we would think about the parasympathetic nervous system. That's the rest, the digest, the heal, the restore part of our nervous system, meaning the train tracks from our brain that are actually going all the way down to the private areas are different than the parts of the train tracks that control stress. And sometimes for men under a lot of stress, under a lot of anxiety, those train tracks might not work as well. Another piece that you want to look at with erectile dysfunction is your cardiovascular system. So if there are men with a history of cardiovascular disease, uncontrolled cholesterol, uncontrolled blood sugar. Those will directly affect a man's ability to gain and maintain an erection. Now you might think why? So first off, when we're thinking about those things, let's talk about blood sugar, for example. From your heart, they're giant, giant highways, like 4-lane, 5-lane highways. If you're on 696, if you're on 75, for example, that are taking blood from the heart to all the places to the body. Now, when you're thinking about the blood vessels that are going to help an erection, we're thinking about tiny, tiny 1-lane highways that only go one direction. Now we're thinking about glucose, we're thinking about a cholesterol. Those molecules are giant, right? So on a 4-lane highway, they have enough room to get around. But when those type of giant molecules get to those small lane highways of your private areas of the reproductive system, they block up the blood flow to those highways, and that directly diminishes the quality, that directly diminishes the length that a man is able to maintain an erection, right? And you also specifically want to think about the types of treatment that a man has gotten through his cancer journey. So for example, what we see is that if a man gets surgery, let's say if it's from bladder, let's say it's from colorectal, let's say it's from prostate, what usually happens is the erectile function drops where it crashes immediately, but then over time with support, over time with help with metabolic markers, it increases slightly, right? The opposite is true for radiation for those same type of diseases. For colorectal, bladder, prostate, what happens is there initially is that kind of boost in erectile function, then over time, that erectile function drops or diminishes. So we don't want to think about one thing that says, okay, if I do this one thing, that's going to cure my erectile dysfunction. Not necessarily, because oftentimes when people come in or men come in with a prostate diagnosis, a colorectal diagnosis, oftentimes because these are metabolically driven diseases, there are underlying conditions like diabetes, cholesterol, other metabolic markers that are contributing to erectile function before the diagnosis was even found.
So I don't know if we lost you. Did we lose you?
Nope, still here.
Oh, perfect. You just paused. Okay, beautiful. So let's talk briefly about supplements for erectile dysfunction because they can be very helpful for both libido in men and libido in women. So I'm going to mention a couple on here that we know have some evidence. And I'm going to mention only the ones that have evidence on both sides of the table, meaning for men and women, biological men and biological women. So arginine, CoQ10, magnesium, and we like to use a bowel neutral form, which is glycinate, meaning it doesn't cause diarrhea. And I'm putting these in the chat. Resveratrol, DHEA, ashwagandha. The only problem, again, with these supplements is the way we're dosing them, the risk of interactions. So things like ginseng, resveratrol, can interact pretty significantly with a lot of cancer drugs. Ashwagandha is a great one that doesn't. CoQ10 usually doesn't, but it does interfere with radiation. So it depends on the person. So again, when a person comes into our practice, we are asking a lot about your history, your social support system, your early childhood, your everything from head to toe, everything your normal doctor asks you, but all of the other pieces as well. And then we do comprehensive blood work that looks at some of the things that Dr. Mensah is talking about, which is how does your cardiovascular system work? Are you absorbing nutrients? Are you at risk for heart disease? How does your body use fat and sugar? And that gives us a lot of data about how to tailor a plan that would actually work to support better sex health for you and your partner. But I did want to say, somebody had a question about estriol. And again, if anybody has questions about supplements, this is the time to ask them. I hope I'm not missing anything. I've been throwing up in the chat a bunch of resources while Dr. Mensa was talking. So there's a question about sea moss or elderberry. And so Dr. Mensa, I'm going to have you take that question about sea moss or elderberry for both men and women. And while he's thinking about that, I want to put some types of questions up here that I think would be useful. Let me go ahead, by the way, and screenshot this to the group as well. Let me move this out of the way and let me screenshot this. And while I do that, Dr. Mensa, sea moss and elderberry for what, dear? For libido, for, oh, where's my chat? Where did my chat go? Here we go. For libido, for vaginal dryness, what are you asking about it for? Because it really depends on what you're asking about it for, and then we'll talk about how we can talk about answering that. Go ahead and pop that, your answer to my question in the chat there. I just screenshotted that there. But what I wanted to put here are the types of ways you can frame questions. So a lot of people are talking about how painful and scary sex is and how difficult it is, and really not wanting to do anything about it anymore, just feeling like giving up. And so what I wanted to put up here is the types of questions that we can ask when we have a partner and we're struggling in this way. So questions like, I feel like I never have any energy for sex, but I'm worried about how you're feeling about that. Maybe we can work out a plan together. So that would be something like planning or scheduling just a low stress intimacy exercise. I see that, my friend Amber. Elasticity or dryness and elderberry for overall well-being. Dr. Mensa? I'm going to show you the way I like to be touched and the places that are sore or out of bounds. So it's okay to take some things off the table right now, to say there's parts that I don't want to be, there's ways I don't want to be touched, and there's ways I do want to be touched, and there's parts that I don't want to be touched right now. There's some things I would like to try to do together that'll help us feel close and connected without going all the way. Or I really miss our sex life. When can we talk about being physically close again, which doesn't necessarily mean intercourse? So while Dr. Mensa is answering the question about sea moss and elderberry, I'm going to pop up here how you guys answer those questions yourself. And you go ahead and putting up PubMed.
Okay, so the question is about supplementation with elderberry and sea moss for elasticity or dryness, and then also elderberry for overall well-being. So with elasticity and dryness, there isn't enough data to say that either sea moss or elderberry would directly improve elasticity or dryness. Now, what I will say I would consider sea moss for or elderberry for in terms of overall wellness. Sea moss being a sea vegetable or sea type of plant, one is very mineral rich and dense. So if you know that you're someone who prone to things like dehydration, know that you're someone that prone to mineral deficiencies, sea moss might be something that you can use to help offset those deficiencies. Elderberry, usually I think of elderberry as one of an immune support. So during flu season, I dose it as a prophylaxis for people who just don't want to catch the cold and boost their immune system, especially when we're worried about things like COVID and whatnot. But in terms for necessarily vaginal dryness or elasticity, I wouldn't put all my eggs in that basket for those things.
No, you want to really focus on, if you're thinking about supplements, you want to focus on magnesium, fish oil, gut supportive supplements like probiotics, and phytoestrogens, which means plant-based substances that will shift your production away from causing forms of estrogen towards cancer protective. That would be things like red clover, raspberry leaf. Beans and legumes are a great source of support for vaginal dryness. Elderberry is also only effective in the first 3 days of exposure to a pathogen. It is supportive for your immune system, and in a low dose, it's safe with cancer treatment. It's not in a high dose. CMOS, as Dr. Mensah said, quality and source really matters because you're talking about something that can be highly contaminated depending on where it's sourced from, and also is really best for people who are mineral deficient, which you may be having gone through treatment. Many of our patients are mineral depleted, but we like to supplement minerals in a different way where we're not trying to force them through a gut. So we might do IV therapies which will allow us to bypass the gut. And we might use a lot of botanicals in a tea form, and really work on nutrition in different ways. I know there's so much buzz right now on Instagram, et cetera, about CMOS and collagen and things like that. And it really is hard because it's not about there being a magic natural therapies. All natural therapies are magic. And it's not about a natural therapy fighting cancer. What I was showing you guys just now is PubMed. So PubMed.gov is where the government publishes all clinical data done anywhere in the world at any time on any natural therapy or drug. And this is how your doctors are finding the information that they need. So if I put in vitamin D in cancer, you'll see that there are 6,000 studies in the last 10 years on how vitamin D supplementation works in a cancer population. And I can filter for clinical trial and just pull the hospital-based data, which is still really robust, about 400 studies here. So when we're talking about natural therapies, we're talking about natural therapies that have evidence. If your friends and family advise something to you, you can always put it in PubMed yourself, and look at it yourself. And I'm putting that link up there on the chat. And you can look at the quality of the evidence yourself. Coming back to what Dr. Mensah was talking about with, was it CMOS? I just got distracted by a note on the chat here and lost my train of thought, but CMOS maybe. That we want to always focus on source. We want to be very careful about where we're sourcing things like probiotics, krill, CMOS, anything that maybe isn't sourced properly. So before we close, I wanted to ask people if they had any other burning questions. I see here a question about estriol. So let's see, let me go back to estriol. Does estriol help with other things besides vaginal dryness, elasticity, energy, sleep, and mood, for example? Yes, it does. And that's because when we're talking about estrogen or resupplying estrogen or changing the way our body uses estrogen, what we're really talking about is a hormone that's really necessary in many different ways to support heart health, bone density, sleep, and mood. So yes, it will have a mild effect there, but not the kind of effect that you would see if you were supplementing with bioidentical hormones or with hormone therapy. Applying a tiny little bit of estriol topically is not the same thing as taking estrogen replacement therapy, which would be not appropriate for a person who had a hormone positive cancer, nor is it safe in general. Any other questions about that piece? So the last thing I would say, when we're talking about sex and intimacy, with a cancer diagnosis, there's a great book by Judith Viorst called Necessary Losses. I'll put it in the chat here. Dr. Mensah, actually, can you look up the link for it? Necessary Losses by Judith Viorst, and post the job form as well. That book talks about trauma and journeys and pain, and she talks about how we become who we're meant to become through the struggles that we face in life. And as painful and as difficult as this journey is, and I'm not diminishing anybody's experience here, there are things that we lose as we go through this process. we lose control, we lose privacy, we lose finances, sometimes lose our marriages. We lose pieces of our body, but with those losses come some really concrete gains. We find out who our support system is. We find out whether we had intimacy in the first place with our partner. We find out different ways to connect with ourselves, different ways to connect with the world. And as difficult as it is to ask anything more of you as a patient who has gone through this disease, I want you to think about not thinking about this as a one and done, but a process over the next couple of years that you can work on to learn how to connect with yourself and others authentically, with coming from a really true place of vulnerability and not really focusing on intercourse per se. Intercourse will come. No pun intended. But I want you to really treat it as there's a possibility for a really magnificent and extraordinary gain here. And in fact, studies show there's programs that have piloted this at hospitals where they do a 16-week course where they work on intimacy with couples and work on just the mental and emotional pieces. And we find that even surveying these couples 5 to 10 years later, their marriages are stronger, their partnerships are stronger, and they report much lower rates of depression and anxiety. So let's take intercourse off the table. Let's focus on intimacy, and let's try to find a different way of looking at this topic and exploring this topic so that we can have a gain here, because we all need a win as we go through this. Okay? It was our honor to talk to you today. You're so welcome. We threw a bunch of words and resources and language at you. Shelby will be posting this on Gilda's archives. We'll post it on our website, our YouTube channel. And I believe, Shelby, do you make the chat available to patients? Are they able to see all these resources in the chat?
Yes, so I'll transcribe it in the email that I send it out to them as well. So they'll not only get the link to the video, but they'll have all of the recommendations in the chat too.
Okay, good. And then again, that Jot forum that Dr. Mensah posted on there, if we didn't get to your questions or you have questions about natural medicine, nutrition, cancer, and beyond, go ahead and click on that, and you can write to us privately, and Dr. Mensah will reach out to you personally and answer those questions privately, okay? And again, our honor and our pleasure. So we will catch you on the flip side. You're more than welcome, everybody. I see all those thank yous and those hugs and those kisses. We love them. And you really make us who we are. You're more than welcome.
Thank you both so much, of course, on behalf of Gilda's and everybody else. We always appreciate this talk, and be sure to check our calendar. Dr. Roy is always doing presentations with us. Dr. Mensah is always doing presentations with us. So be sure to check the calendar and see when they'll be back next.
Okay, talk with y'all soon.